Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus will now switch to healthcare. My next guests represent an organization that's mission is to provide accessible, quality primary and related healthcare services to Milwaukee residents. Milwaukee Health Services Incorporated. Dr. Tito Izzard is the president and CEO of MHSI, and Pamela Clark is the corporate communications specialist. Good morning.
Good morning.
Welcome to the show. And I'm really excited for you to tell our viewers at home more about Milwaukee Health Services Incorporated. You actually operate 2 sites here in Milwaukee. Tell us more.
Yes, Milwaukee Health Services, we're a federally qualified health center. Now what that means is just like any other practice, we offer full spectrum primary care services. We have a variety of different providers. But what's unique about us is that we don't turn anyone away regardless of their ability to pay. So we offer a sliding fee scale for those who financially have difficulty paying for their visit. And so everyone is able to be seen whether you have insurance or no insurance.
Okay, and I did mention you have 2 sites. Where are those located specifically?
So our 2 sites, the Martin Luther King Heritage Health Center, it's located at 2555 North Martin Luther King Drive. And our second location, our Isaac Coggs Heritage Health Center, is at 8200 West Silver Springs Drive.
Okay, so you did mention you offer a range of primary health services. So when you look at someone needing to see a dentist or a podiatrist or whatever the case may be, you really do have a little bit of everything under the umbrella of what you are able to offer to individuals. So it could in many ways be a one-stop shop, right?
Absolutely, and that's how we refer
so to speak.
It. Absolutely. So primary care, when we talk about primary care, we talk mainly about for family medicine, internal medicine, pediatrics, and women's health. So around that primary care, which you refer to as the one-stop shop, we also offer other services such as dental, behavioral health services. We have a WIC clinic, women, infant, and children. We have podiatry available. We have pharmacy on site. We have a early intervention program which focuses around HIV prevention and treatment. And so a lot of comprehensive services that we offer to make sure that everyone in the community receives the services that they need. And so we focus on treating your acute conditions. We also focus on chronic health conditions to keep you healthy and well as all the preventative services such as making sure you get your mammogram done and your x-rays that you may need to have done or any types of lab services are right there on site.
Yeah, it's a long list of services and it really is refreshing to know that you are there for everyone. You actually target the residents of Milwaukee's North Side, but you service patients from all over the county.
Absolutely.
Yeah.
And each year we'll see between 25 to 30,000 individuals will walk through one of our 2 clinic sites. And with that, they will receive any of those services that we just mentioned.
And my girl Pam over there, we've worked with many different events with Jammin' 98.3, and it's really refreshing to see how the Milwaukee Health Services Incorporated puts on special events to kind of incorporate the community and let them know that your services are there for them, and you're also building relationships between the employees there and the community. So if you would, as the corporate communications specialist, you have put together plenty of community events. Talk about the importance of presenting that to the community.
I think one of the important things about presenting it to the community is we can just all gather together. The businesses in the area, because a lot of the times when I do plan an event, I include some of the businesses in the area. I've worked with Harambe Neighborhood Initiative before, Columbia St. Mary's, Grow Empower. We all come together in the neighborhood, the one at MLK especially, we all come together and we have events, and the people, the neighbors are involved, and then we can also bring our patients, they're involved, children are involved, and I like to have different services where the community are able to like receive their blood pressure checked, or if a woman needs her mammogram, we'll have that available that day. They can get same-day treatment. It's a big need for dental services. I always try to have dental screening done that day, or immunizations. I want to have everything that the the community might need, I want to have it available that day when I plan an event.
Yeah, and that's a time when sometimes people find out information that could be critical to their health. So if someone comes and gets their blood pressure taken and it's extremely high, and you're saying, hey, you could very well be on the verge of having a stroke or a heart attack, and you need to see a doctor immediately, those are situations that occur.
We had a health fair in April, and that was at our Isaac Cox Heritage Health Center, where a gentleman came in before, he heard it on the radio, and he came in to get his glucose checked, but the nurses weren't there yet. He came back. His glucose was extremely high, had to go to the hospital. He had commercial insurance. He came back to MLK Heritage Health Center. He set up a primary primary provider there, and now he's just a regular patient coming through all the time, and always waving when I see him.
Yeah, and that's a great story, and that's what it's all about. And you do have a big event that's coming up very soon, so we want you to tell us more about that in just a little bit. But first, if you would, Dr. Izzard, you've got the Milwaukee Health Services Incorporated that's governed by a board of directors. So how exactly does that work?
Well, as a fairly qualified health center, we're an independent, not-for-profit organization with a specific mission and emphasis on serving the underserved community. So that type of model of practice, we have a board of directors with the majority of the board actually being patients or users of the various services that we have. And that structure is the same that you'll see throughout the United States. But it allows us to really have that grassroots approach to listening to the needs of that particular neighborhoods and community. And by having our board members actually utilizing the services, they get that firsthand experience and knowledge of what's actually going on, and they bring that back to the board level. The other 49% of the board is made up of various levels of professionals that can assist with the overall running of the organization operation. And our board chairman is Spencer Cox.
Okay, so everyone's able to bring their expertise to the boardroom and actually do what's best for all of those individuals who are patients of these facilities. And you guys have been doing an outstanding job. How long has MHSI been around?
We've been around since around 1989. And a couple of years ago, we saw our 1 millionth patient.
Wow.
So we've had lots of services over the years and lots of care being delivered. And there's we're talking about the services that are delivered in the four walls of the clinics, but there's a lot of things that we do outside, not just the health fairs that Pam is mentioning, but we also on a regular basis are out in the community doing outreach and enrollment, helping people who are not patients of the center, informing them regarding when the changes occurred with the Affordable Care Act and making sure that people were able to get enrolled with insurance and making sure those that are eligible for Medicaid coverage to make sure that they have access to getting enrolled in those types of services also. So there's a lot of other services we provide besides just providers, physicians, and other nurse practitioners and physician assistants, but we also have prenatal care coordinators as well as the outreach and enrollment specialists, benefit specialists.
Yeah, and with that said, you also have a social work department. So you've got services for fathers, case management, like I said, a long list of so many things. So it would be wise for someone who's interested in coming by either of the facilities to go to your website or give you a call to see how you could best serve them. So what is your website address?
Our website is www.mhsi.org.
And your phone number?
And our phone number for our main location, 414-372-8080.
Okay, and that's the MLK Heritage Center, and the Isaac Cox Heritage Center. That phone number is 414-760-3900. And I did want to talk about the fact that we recently, in the last few years, have come with the Affordable Care Act, and you mentioned how you worked diligently in helping individuals understand what works best for them and how it would actually benefit them to choose certain plans. So with the Obamacare, one of the main things that's focused on is preventative care, because what President Obama does not want people to continue doing is wait until they feel bad and then go to the emergency room, as opposed to, you know, just getting that annual checkup and being able to stay healthy and ahead of the game before it turns into something more serious and more costly.
Absolutely,
Yeah.
absolutely. And that's one of the great things in this city. We have a larger group called the Milwaukee Healthcare Partnership, which actually is all the federally qualified health centers. There's 4 of us here in town, as well as the hospital systems and other key partners working together to ensure that in this community we assist as many people as possible to get coverage, to help them enroll for insurance coverage, to make sure that they have access to a primary care provider, as well as trying to reduce the amount of emergency room utilization that frequently occurs for primary care related conditions. So all of us as a community working together to ensure that people can get those services done. Now, this preceded the Affordable Care Act, but especially now when we have more people having insurance, one of the big issues is making sure that they have access to what we refer to as a patient-centered medical home, which means that you as a patient can come to a facility where you can get all of your care taken care of. And we work collaboratively as a team where, in addition to the services I mentioned, we also have pharmacists on site that actually can work with patients reviewing their medications, help them get better outcomes for patients that may be on a lot of medications, and do that type of one-on-one assessments right there at the site.
Good stuff. And before we run out of time, Pam, you've got this big event coming up on Sunday, September 27th. Tell us more about it.
We're having an open house, and it's going to feature Cedric the Entertainer.
Cedric the Entertainer.
Yes, I cannot believe it, right?
That's huge. That's huge.
And we plan on having health screenings that day. We're going to do mammograms. We're going to have flu shots because it's flu season, immunizations, dental screening, cervical cancer screening, glucose, and we're going to, like I said, check blood pressures. Also, we'll have Christopher's Project. They'll be singing, featuring Mr. Jackie Caldwell. We'll have food, games, and you'll have a Q&A with Cedric that day.
I am very proud.
She's our host.
I'm going to be there. And is this free and open to the public?
It is free and open to the public, thanks to our sponsors, Molina Healthcare, Anthem Blue Cross Blue Shield, MHS Health Wisconsin, and I'm sorry.
That's quite all right.
Yes, we have a number of
She did a very good job of remembering all of those. So easily people can go to your website, get all the details. Again, that's happening on Sunday, September 27th, featuring Cedric the Entertainer. Looking forward to it. Thank you both so much for stopping by.
Absolutely.
Thank you.
It's been a pleasure. Dr. Tito Izzard is the president and CEO of Milwaukee Health Services Incorporated, and Pamela Clark is the corporate communications specialist for MHSI. For more information on anything that we've discussed today, log on to mhsi.org, or you can give them a call at 760-3900 or 372-8080. That's going to do it for today's show. I'm your host, Andrea Williams. As always, I thank you for watching, and I do hope you join us again next week as we take another look at our issues. Milwaukee, have a great day.